more questions in our final segment at 3:30 and go into more detail on some issues, particularly the medically unexplained symptom or some of those areas. Okay. I think everybody knows who I am. I'm currently president of ILADS, incoming president of ILADS Educational Foundation, president of New Jersey Psychiatric Association, associate professor of psychiatry at Robert Wood Johnson, and private practice. And so today I'm talking about, can infections and immune reactions to them cause violence? So I have 45 minutes to answer that question. So let's look at that question. My disclosure here. What I'll do is I'll look at, first of all, defining violence and then giving some case histories, my clinical summation of my impression, looking at animal models, using a multi-system approach where I'm looking at different contributors and deterrence to violence, the epidemiology of violence, regions of the world prone to violence and whether that gives us any insight, looking at war zones and violence and infection, seeing what the association is there, and what infections are associated with violence in the medical literature, what medical literature there is regarding tick-borne disease and violence, looking at the pathophysiology, the psychoimmunology, and the genetics, and then looking at prevention, treatment, and summarizing it all. So first of all, looking at the definition. It's the intentional use of physical force or power, threatened or actual, against oneself or another person or a group or community that either has a likelihood of harm. Now, when we break it down, there's a number of ways to categorize it. 0.43 million deaths per year in the world, and much of that is individual acts of violence, more so than collective violence. If we look at some case histories, and these are fairly representative case histories, I've treated a few thousand Lyme patients, and I do this, are you homicidal? And a couple hundred have said yes to that over the time, and I'm not going to give all of these cases, but there's a lot of it that's a lesser degree. So this is a fairly common case. You might see a female patient who's a shoplifter and then might be arrested, and there's different subtypes I've seen here where sometimes it's a confusion issue where they're just disoriented. They sometimes don't even know they committed shoplifting, and now they're walking out with something, and then the security guard apprehends them and they think they're being assaulted, and they're baffled by the whole incident. Other times it's a compulsive thing. And other times I've seen where just one patient who would shoplift right in front of the security guard, where it was like an irresistible impulse type of thing. Then you can often see also a variety of different impulsive behavior. Now some of these are drawn from my case history, some are drawn from media, and some are drawn from both. So this was a woman who was sentenced to prison for inappropriate sexual behavior with her 9-year-old. So that falls into that impulsive category. So the impulsiveness might be sexual, may be aggressive, might be both. This is a case of stalking. You see some stalking cases. This was someone who's been stalking Sarah Palin. It keeps reappearing in the media. And as a history of other stalking behavior with other individuals, which is a supposed case of Lyme according to the newspaper. Now this is something that comes up a lot, and this is a good description by one patient, and this is the issue of intrusive symptoms. Intrusive is where it just comes, and it can be an intrusive horrific image, or it can be intrusive to do harm. This is just intrusive image. It's like you're sitting there and all of a sudden you get a movie clip from a cheap horror movie, like a Friday the 13th type movie. So frightening, stabbing, horrific images, blood and gore that just come from nowheres. And like, where did that come from? I don't understand it. You can see it as a subtype of OCD. It's similar to what we see with post-traumatic stress disorder. So it's a category of intrusive symptom. But intrusive horrific image. Now this is someone who had intrusive images, intrusive symptoms to do harm. This is someone who in childhood had 100 tick bites, and they would become obsessed with females and then become homicidal and intrusive thoughts of killing with a knife and axe, and there would be these intrusive urges to kill, and Some of that would be towards the sister's child or his mother. In this case, it was towards females selectively. This person had 1 year of antibiotic IV treatment and improved after the 1 year, where it was still there, but much to lesser degree. This is another case. This was a female who had aggressive and homicidal urges, which were contrary to her normal personality. Now, it's easier when someone's an adult and they have a reference point for health, and they can say, this isn't normal for me to feel this way. It's much more difficult when it's a child, like the case that Dr. Jones presented yesterday with a 6-year-old, where they have no reference point of being healthy to compare it to. And she would look at someone, feel an urge to harm them, sometimes a stranger, and it would be sometimes an urge to harm family members. This is an example. Now, this is a little bit different, where this isn't intrusive, but this is an example of like explosive rage, reactive, often triggered by sound or stimulation. And there's a lot of these road rage incidents. In this case, someone beat him to a parking spot, so he jumped out of the car and knocked the person unconscious. I've had a few cases like this, particularly sometimes beeping a horn, the acoustic startle, and then they would react, and some pounding on windshields, a few people pounding on windshields, breaking windshields. That tends to be a repeated theme. This is a road rage case where a housewife is driving on the highway and a garbage truck cuts her off. She goes into a blind rage. She follows the garbage truck to where they go to the depot, jumps out of her car and is chasing after these garbage men and wants to choke them and jump and attack them. And then she realized, what am I doing? And it was just a blind rage that she was crazed by, and a part of her, then afterwards she thinks about it, how inappropriate it was, but it just overtakes her. She's had other episodes of killing family members and herself, wanting to dress up as a deer and go out in deer hunting season and hope that she would be killed. She is doing better now, by the way. And then this is a case of someone with 14-year-old with violent outburst. The patient would repeatedly attempt to choke his mother to death, destroy the house, knock over furniture, kick and punch holes through the walls and doors. Frequent police calls there. The one officer said it was the most violent teenager he had ever seen. He was upset because of a troubling lack of empathy that was seen with this patient. Now, I'm going to talk about empathy as a facet of violence. We particularly think of the right ventromedial prefrontal cortex as a part of the brain involved with empathy, and deficits there contribute to that facet of violence. And there were issues here with temporal lobe, and that comes up a lot. You can see that showed on SPECT scanning. You can see temporal lobe issues with a certain percent of these patients. Now, he was treated, and now he's doing very well. He's recovered from this, and he's healthy, so treatment did work. This is a case of mycoplasma. He was violent, explosive. The parents would lock him in the house so he wouldn't get into trouble, and then he would jump out of the window. He would sometimes take off his clothes, wander, cause trouble, constant appearances in the emergency room, constant appearances, the police intervention, and a typical case where you see these positive reactivity to Lyme multiple co-infections. And that's true with the other cases that I mentioned that I didn't go into detail as much. This is a case of self-abuse where a person would periodically begin hitting himself or the nurse and scream and curse, punch walls, and a blind rage, and then it would pass. I don't know if many of you have ever seen Lyme rage, but if you ever saw it, you'll never forget it. It's such an uncontrolled thing. In this case, this is someone who, at this point, he was 27 years old, explosive anger. He would be homicidal, suicidal. He would get these intrusive, overpowering, and now we're back to the intrusive pattern, like I was talking about before. It would be triggered by stimulation such as a dog barking, a bird chirping. Sometimes someone chewing might even be a trigger. a strobe light or the presence of other people, stimulation in general could provoke. And he would get this episode of anger where he wanted to destroy things. He said he wanted to rip the room apart, kill everyone and every animal in the house. At times he wished he had an excuse to go after someone. And he was frightened by these urges, especially when he was around children, that he didn't know whether he could stop these urges when they would overtake him.